Hi, my name is Eddie. I'm going to be doing the postpartum assessment today on my beautiful mother right here. So she just gave birth to a beautiful baby boy. We're going to start off taking her vital signs. We're going to check her blood pressure first. Blood pressure is normal at 120/80. Then we're going to check her heart rate. You want to check it for a whole minute. Okay, that was a whole minute. It was at 82. Then you want to take the respiratory rate, for a whole minute also. Her respiratory rate is 16. You want to do her temp also. Her temp is normal at 98.0. You want to take her pain. How would you rate your pain? She rates it at a 2. She's not in pain. And then you want to ask her about her psyche. You want to know, see if assess for bonding with baby. So you ask her, how's the baby, or how do you feel about the baby? Is the baby latching on when you're breastfeeding? Is the baby, are you feeling attached to the baby and stuff like that? You just want to make sure that the mom isn't depressed. Do you want to auscultate? We just auscultated the heart. You want to auscultate the lung sounds. You're gonna auscultate. This is clean. I cleaned it. You're gonna auscultate the lungs in 4 sides. And then you also want to check the back. And like a J. Okay, I hear tear, breath, lung sounds. I also want to auscultate her bowels. And you want to auscultate her bowels before you give her any food or you give her any liquids, just to make sure that the bowels are working. You also want to check for CVA tenderness. So the CVA tenderness, you're just going to hit in the lower back. And no CVA tenderness is reported. Then you want to check her, then we're going to start with the bubble heat. So we're going to check her breasts. When you're checking for breasts, you want to check for any lumps. You want to check if they're soft. You just palpate them. There could be, some cracks or any red sores you'd want to report. You're gonna check her uterus. You're gonna palpate her uterus. Usually, you want it to be hard because if not, the uterus can still be soft and it can increase risk for postpartum hemorrhage. You want to check for any clots, any lochia coming out. You also want to check the bladder, but that kind of coincides with the next B's, because if the bladder's full, then the uterus is going to be deviated to one side. So you want to check for that. You want to check the bowel, which we checked the bowel already. Bladder, make sure it's not full, or else it could deviate the uterus. L is lochia, so we were checking for lochia while you're checking for the uterus. You want to check if there's any clots, any bleeding. Then you want to pick them up also, just to make sure that there's no bleeding under the in the bed sheet, because there's silent bleeders. You might not know they're bleeding, but when you turn them like this, they can start bleeding. And you also want to check their episiotomy from this side, because you can't really see it from the front. So you're gonna just check to make sure that they're doing okay. And while you're down here, you can check the anus to make sure there isn't any hemorrhoids or anything like that. Let's see. You want to check the C-section cut. You just want to do your regular incisional assessments, and just make sure it's and all that stuff. You're gonna check for Homan sign. She mentioned that and we learned in HA that you don't do Homan sign because you don't want to dislodge the clot, but she said that that really doesn't happen. The chances of the clot dislodging aren't really high. So what you're just really looking for is tenderness, any heat. Just make sure you don't want to move too much either. And then I think the E's emotion, hormonal emotion or whatever. So if the mom's crying, it's pretty normal, because her hormones are all over the place. If she's crying, just let her know it's okay. She could be crying because of happiness or any of that. You do want to tell her though that in 2 or 3 weeks, that if she's having trouble taking care of her baby, or she's having trouble cleaning the baby, bathing the baby, or she's just having trouble bathing herself, that's probably postpartum depression, and she's going to want to tell her provider. There's also going to be skin changes, like in the face. Some moms get it, some don't. It just depends, honestly. Then there's going to be the linea nigra. That usually fades away. It's normal if it starts fading away after a while. And yeah, that's my postpartum assessment.